Well, let's get started. First of all, let me just say a special thank you to each of you for being here today at our press conference. And first of all, just to reiterate what I think each of you are aware of, that this January, I launched the Georgia's Healthcare Reform Task Force and charged its members with bringing forward solutions to lower the cost of care, premiums, and deductibles so that Georgia families have access to a quality care they need at a price by which they can afford. Our state is ready to advance a bold, conservative vision for health care reform that addresses the needs of all Georgians. This is essentially true for, and especially true for our rural communities. Many of you are well aware of the hospital closures that have occurred, along with the workforce challenges that exist and limited access to primary and preventive care as well. I'm excited to join both Senator Renee Unterman today, along with Senator Dean Burke, who have put forward two great legislative initiatives. Last year, Georgia spent more than $13 billion on a health care system. While our state is one of the most fiscally responsible in the nation, our health system must become more efficient and also effective in terms of delivery. Senate Bill 357 will bring together every level of our state's health system under a clear vision for the future. By eliminating duplication and breaking down silos that limit communication between government agencies and the private sector, we can significantly improve the quality and affordability of care. Georgians deserve a system that isn't riddled with bureaucracy, and our focus will meet the needs of every patient with better access, lower cost, and lead to higher quality of care. Senate Bill 357 creates Georgia Health Coordination and Innovation Council, a statewide platform which will focus on cutting waste and, most importantly, improving coordination across all the functions of our health care system. The council will eliminate barriers to quality, affordable care, and develop a much-needed innovation that will modernize and improve our state's overall health care system. Our efforts will draw a heavy focus on rural Georgia, ensuring that across every region, county, and community, Georgia will have access, and Georgians will have access to the care they need at a price by which they can afford. Big government will not improve our health care system. Our challenges and our greatest challenge is taking on our state's much-needed high poverty rate, helping individuals climb up the economic ladder so they can become self-sufficient and provide for their families. I'm also very excited to stand with Senator Unterman as we announce the next step in our state's direct effort to combat the opioid crisis as well. I just left a moment ago individuals that have seen this epidemic up close and personal, and many of those that have lost loved ones and family members as a result. And certainly our heart and our thoughts and our prayers go out to those individuals. There are far too many that exist across our state, and this is something in which all of us, each of us as communities, have to come together in a way that really provides the treatment and the preventive measures that are necessary for these individuals as well, and undergirding and shaping or sharing with them our love and affection as well through this challenging time. Senate Bill 352 has generated the support from so many across our state as we all recognize the seriousness of the threat opioid posed to our citizens as well as our communities. Nearly 180,000 Georgians are estimated to have an opioid use disorder, and opioid-related deaths have increased by 55% since 2012. These numbers are staggering. We must act now to turn the tide facing Georgia families. And at this time, I would like to turn the podium over to Senator Dean Burke to speak to Senate Bill 357.
Thank you, Lieutenant Governor. I want to thank the Lieutenant Governor and Chairwoman Unterman and the leadership of the Senate for the opportunity to do what I feel like I was brought to the Senate to do, which was improve healthcare outcomes in this state. That is my passion. Although when my constituents call about an issue with their driver's license or some other issue, I always answer the call. But my passion is improving health care, and as a physician who's practiced medicine in rural parts of Georgia for almost 30 years and have been a hospital administrator for the last 5 or 6 years in a rural hospital, I feel like I am particularly qualified to have opinions on how we can do it better. And one of the things that I was taught a long time ago is if you want a different outcome, you've got to do things differently. And Senate Bill 357 was designed to do that. We are trying to develop a mechanism or an infrastructure that will help us to improve our healthcare outcomes in the state, improve access, and I feel like the Lieutenant Governor summarized that very well. We patterned this bill on the criminal justice reform that Governor Deal initiated 5 or 6 years ago, trying to develop a central point where great ideas can be vetted, and then developing an innovation center, which is, I think, a new idea that will be hosted by our academic institutions to make sure that any policy that we develop has clear outcomes and accountability built into it, so that the taxpayer dollars, the billions of dollars that Georgia spends on health care, will not go to waste. We have some of the greatest institutions in our country of training doctors, educating physicians. Our hospital system, I think, is second to none. We have a great track record of economic development. And I wonder why our healthcare outcomes are not much better than they are. And I think that, again, we've got to take a new approach to that question and make sure that we get everybody in the room and develop those central principles and plans to improve those. And I think Senate Bill 357 is a first step towards that. I welcome people's questions and input. I learned 6 years ago that this is a process, and there'll be a lot of second guessing and criticism. I understand that. But along the way, I also expect some new ideas to come out that'll be better than the ones that we've come up with, and I welcome those. Thank you for listening. I think that Renee's going to finish, and then we'll take questions.
We're asking for questions.
We'll answer questions afterwards, and we do have another overflow room. It's in room 307 upstairs, and I'm very proud, and I'm waving to all those folks. I bet they're up there cheering, I don't know. But waving to those folks and telling them thank you. I have Judge Schrader here with me. You want to come up here? And I have Robin Cardigis and Kathy Abrams, and I have a very special guest. I think the sign of a great leader is a leader who trusts in the people that work below him. And I have to say the Lieutenant Governor, Casey Cagle, has done a great job in basically turning the Senate Health and Human Services Committee loose. And this summer and fall, I had the pleasure, along not only serving on his task force and traveling the state, but also going to other parts of the state. I'm a urban legislator, and I don't know as much as I should about the rural areas. So I took it upon myself and the legislators from that area, and I have to say a big shout out to Senator Freddie Powell Sims, who took me into Southwest Georgia and showed me what really the disparities are in the state of Georgia, especially in health care, and knowing that there are two Georgias, and spending time in Southwest Georgia right along the Alabama and the Florida line with Georgia. And I've traveled all over the world, and I recognize that the two Georgias are really like a third world country. And that's why I have worked so aggressively. I've been to Albany, Georgia 4 times this year. And I want this girl right here to come up here and stand with me. This is a young woman who is a part of a group called the Bread House in Albany, Georgia. And I believe the name of the recovery center is called Graceway. Is that right? She is 1 year in recovery on Wednesday. Can I get a round of applause? And in our travels that the Health and Human Services Committee has done, we found two centers of excellence. One is called the Zone, which is in Marietta, Georgia, and it's the Davis Directional Foundation. And it is a peer-to-peer support recovery center that is unlike any other that I've found in the state of Georgia. And then when I went down to Albany, the thing that was unique about Albany and the Bread House, it's a farm to table where recovering folks have the opportunity to be able to go and work. And it's a system that works very well, and these are two systems that are infrastructure that are indicative of what we would like to replicate. So I will digress from here. I know the Lieutenant Governor is pulling on my back here, telling me to move on. I could talk about this for a very long time, but I want to talk about Senate Bill 352. And Senate Bill 352 was crafted in the acknowledgement of the opioid epidemic that we started working on over 3 years ago. And we have had forums literally all over the state of Georgia. And this is not these senators that are standing up here. This is not their bill. This is not my bill. We have heard not from hundreds of people, but from thousands of people. The very first forum we had in Gwinnett County, there was over 500 people who attended. We started having these forums in the metro area in Gainesville, Cherokee County, Forsyth County, and then we started migrating down to Tifton and Albany. And these recommendations, these prioritizations are what the people in the community have come up with and said, this is what we need, this is what the state of Georgia needs. And as the Lieutenant Governor talked about, the statistics and the death rates that have increased from 1.4% to 9.5 individuals per 100,000 from 1999 to 2016. The Department of Public Health reported that in 2016, opioid-involved overdose accounted for 2,435 emergency room visits and 929 deaths. That's absolutely incredible. We've done phenomenal work with naloxone and Narcan and improving that, but we felt like this bill takes it a step further. The one part of the bill is called patient brokering. And patient brokering is when a healthcare facility pays individuals a referral fee for sending an addict to their treatment program. And you think, well, that really doesn't happen. But I pulled a quote from an attorney who is the prosecutor in Palm Beach County, Florida. And he says, many so-called sober homes in Florida are nothing but flop houses, said David Ehrenberg, the state attorney for Palm Beach County. The only county in Florida that has a task force aimed at addiction treatment and sober home fraud. And that's what this is called, sober home fraud. And what he referred to as the Florida Shuffle. And who do you think would be the reciprocal state? Unfortunately, because we're the neighboring state of Georgia, that's why we are targeted. A patient gets a free one-way plane ticket to Florida, goes through treatment covered by insurance, and needing a place to live is referred to as sober home. But when those benefits are exhausted, the individual leaves the sober home. If the patient relapses, however, the patient gets treatment again. So rogue providers make sure drugs are accessible in those sober homes to ensure relapse and continued profits. 75% of private pay patients in Florida centers come from out of state. 75%. That's a phenomenal number. The second part of the bill is the Commission on Substance Abuse and Recovery, and it really fits and dovetails into Senator Burke's bill. There are so many state agencies that when we started working on this issue, that every state agency, just like we were talking about criminal justice reform, there's not an agency in the state that's not touched. And this is the whole purpose of creating this council. It will have an executive director, and all summer and all fall I've been calling it the drug czar, but the official title is the executive director of substance abuse, addiction, and related disorders. And we're not unlike other states that are having to do this, like Kentucky, West Virginia, and Indiana, that have already formed these. Excuse me, my notes are a little bit off. The last part of the bill is what we really heard from the families. A lot of families, like this young lady standing right here, are going through recovery. And unfortunately, when you see a lot of money dumped into an epidemic, there are people who try to capitalize on it. And it involves lab testing, where repeated tests, unnecessary tests, are ordered on urine and blood, and they run up the cost. And not only are those families complaining, but insurance companies are complaining, and that's one of the main drivers of running up the cost of health care, is people exploiting on an issue. So it's a comprehensive bill. We'd be glad to go over it and answer questions after that. I'm going to turn it over to Judge Schrader and let her talk about recovery centers.
Good afternoon, everyone. My name is Kathy Schrader. I am one of the felony drug court judges in Gwinnett County, and I have been on the front line of this epidemic for 4 years since I started my drug court division. I'm here to tell you that I applaud everything. I am excited about the work that the legislators have done. Senator Unterman, Senator Burke, Lieutenant Governor Cagle, everything that I have read in this bill excites me. But I'm here to lay down the challenge that the reason 75% of the people go to Florida from this state is because we don't have treatment in this community. We don't have treatment in this state. We can have all the policies and procedures that we want, but until we provide quality, affordable care, treatment, we are going to fail in our war against this epidemic. We don't have a war on drugs. We never had a war on drugs. That has been the wrong focus. We have a war for treatment. We are in a battle to support those in recovery. Recovery is real when it's done right. The science over the last 5 years educates us, and the data is indisputable, that addiction is a brain disease. The NFL concussion care has come so far because of the science that has been given to these physicians and to these communities about what happens to the brain. The same application is relevant for the disease of addiction. It's time for us to accept the science. It's time for us to lift the shame. It's time for us to change the stigma, accept that addiction is a disease. I can guarantee you that all the statistics that were just read here in this room today are wrong. I know it because I live it. There is an average of 175 people in our country dying from substance abuse disorder on a daily basis. That means as we stand here today, a few people have overdosed and died. That means that so far this year, over 5,000 people have died because we don't have quality, affordable care, brick and mortar resources. So please support the work that our legislators are doing. I applaud the state of Georgia for being a leader in this opioid epidemic, but it's not just opioids. It's about recovery. 24 million people are living in long-term recovery. It should be more. That's a great number, but it should be more. It should be more. Studies show that when somebody has accessible treatment in their community, where they build a sober network, they have a higher probability of maintaining long-term sobriety. Why is that important? Because it eliminates the number of drug-endangered children in the hospital or in foster care. Why is that important? Because it reduces the number of people that need to be sent to the morgue. Why is that important? Because it reduces the amount of services that we need to pour into the school systems to address children in crisis. So the way to eliminate the economic impact and the morality impact of losing so many people in our communities is to improve quality care. So I applaud all the champions that stand behind me today in regard to addressing this, and especially all the moms who have come forward and made sure that this has become something that is on the forefront of everybody's mind. Thank you.
Hi, everybody. I'm Robin Cardeges. This is my son, Stephen, who on August the 12th, 2012, we got that knock on the on the door after we were in bed that you never want to get. He was in a vehicle with other individuals. He experienced overdose, which is respiratory failure. Those other individuals drove around with him because they were afraid that they were going to get arrested, and they were. When they finally got to a home where someone had the good sense to call for medical assistance, they did not have the naloxone, the antidote naloxone, which could have saved his life. So by the time he got to Eastside Medical Center, he was dead on arrival. I'm sorry I shake a little bit when I tell this story because it hurts. So I saw in Macon, in North Carolina, they were getting this law passed in 2012 and early 2013. And I thought, oh, we need a law. We need a law. So I talked to Senator Unterman when she had one of her community drug forums in late 2013, and she said, I can sponsor this, you can do this, but you're going to have to tell his story millions of times, which is very difficult. So on April 24th of 2014, Governor Nathan Deal signed the 911 Medical Amnesty Law and Naloxone Access Law. I'm not going to, we know what the law is. What we do is we go out and try to educate people. But within that same week, we learned of a young person who had a fatal overdose because they were not aware of the law, because they did not have naloxone access. So there are some super passionate grassroots women who worked with me, and we had the support of Representative Sharon Cooper on the House side to get this bill passed, and we formed Georgia Overdose Prevention. My numbers as of last month, since we started distributing kits and training and educating, we have had 1,053 reversals reported, and those are reported. When we train and give a kit, we ask that they contact us and let us know that they've had a successful reversal so that we can get them another kit and so that we can keep track of the numbers. So that is a very underreported number. The numbers for Georgia Overdose Prevention and Atlanta Harm Reduction Coalition is 856. Law enforcement organizations, that's 197 through the Project Dan program. We do not have data on EMT reversals, but we're moving in the right direction, and I am so thrilled to read and reread Senate Bill 952 because it's going to make our job easier. I mean, we're just grassroots moms, dads, friends, loved ones who want to make sure nobody ever has to feel the way that we felt or we feel. And so we'll keep talking. So thank you.
Thank you. Okay. So you want to answer? We just appreciate, I know there's a lot of advocates that are upstairs in the room, and these two bills are emerging, and you're going to see some substitutes. I already have a substitute. But the most important thing is that we are literally springing into action. We have been all over the state of Georgia. We have listened to Georgians all the way from the coast to the Florida line. Senator Burke lives down there. I live in the metropolitan area. We feel very confident that these bills are going to make significant differences, just like the Narcan has made us progress in the opioid epidemic. So, Lieutenant Governor, I guess we'll open it up for questions, and I'm sure they have questions for you, and we'll be glad to. And the media, the advocates are upstairs. If you want to go upstairs and interview them, they're going to be staying upstairs.
All right. Who would like to ask a question?
Lieutenant Governor, I noticed that your council is not going to cost any money to the state, but that it will be funded by donations. Is there any concern that the organizations that are most likely to donate are going to be institutional interest groups that have a goal, and that then the recommendations that come out of it might not be so patient-centered, but might be centered on things that would help, say, you know, the better funded hospital industry, the insurance industry, the bigger groups?
Certainly, those are always concerns. I think it is important to recognize that every individual that will be making up this council will be stakeholders. And so when you are a stakeholder, obviously you are bent towards a certain bias for your industry. Our job here is to ensure that we focus on what is in the best interest of all Georgians. And regardless of the different turf wars that might exist, we will be focused on ensuring that we do find ways in which we lower the cost of health insurance to all citizens throughout our state, and that we have outcomes that we set as goals by which we are striving to each and every day. Certainly when we talk about risk, you insure against risk, right? And we also know that you can be focused on making sure that the risk can go away with the right preventive care up front. And so it's a different delivery system that we will have to have stronger and broader buy-in from all parties. But you can't do this in isolation. You have to have those that certainly are the caregivers and the providers that are out there, along with those that are insuring the risk as well.
When you were looking at solutions, and of course I know Democrats propose this all the time, I just asked the question.
Sure.
Did you consider Medicaid expansion as part of the solutions for lowering costs of care in the state?
Obviously, we get that question quite a bit on the issue of expansion of Medicaid, and I recognize on the front end, let me just say, that there are a lot of supporters out there for growing that sense of entitlement. I have a philosophical difference in my viewpoint, and that is that I believe that we can give people the skills that are necessary for them to have higher paying jobs. I don't think people have to be trapped in poverty. It is our job to create the rising tide that affords individuals to be able to go to the marketplace and purchase a health care coverage at a price by which they can afford. And that is what our single focus is. It does no good to continue to grow government and create additional strains on the budgetary aspect that we currently are in. So my focus is very much about creating that rising tide that lifts all boats and individuals having affordable health insurance. I think that's a much more, it's the longer path, okay? It's a little bit more challenging to do, but we reap a huge harvest by being committed to that effort.
One of their arguments is that that money would help to save rural hospitals sooner.
Well, that's exactly what I just said. I mean, absolutely. If you pour more money into the system, then certainly you're going to artificially hold up a current system. But I believe fundamentally that we need broader reform, and that broader reform has to be done in a very holistic way with all stakeholders at the table to focus on efficiencies along with how do we improve the quality of life for individuals as well. And so it is a much harder path that we have chosen, but I think that in the end it will certainly give us greater dividends.
One more question.
Certainly.
Can you give me an example of something that would be streamlined, that would be more efficient, that people could grasp?
Well, first of all, I mean, this obviously is the council's responsibility. I would highlight just a couple of things that I think are very important. When we talk about the delivery system, particularly in rural Georgia, telemedicine is going to be a huge part of how we deliver that specialty care, but also doing things creatively that allow physicians to be able to be in these rural communities. Sadly enough, the primary care in some communities is very, very limited. And so right now at the Medical College of Georgia, we have a program that allows physicians to be trained quicker, 6 years instead of 8. Those are things that can be done that will accelerate the process and allow us to solve these issues in a much faster way. The other thing I would just articulate is that, I mean, we've seen the individual marketplace where we've had 50% and in many cases 100% increases. This is not sustainable. So all of this that we've been hearing, that if we get more people into the pool, then we're going to see lower cost associated to you and I as individuals. That is a flawed narrative, and it is not proven to be the case. We have to get back to where it really is patient and patient-physician relationship that is working towards an outcome that really garners against the risk that ultimately we're insuring. Okay? Great. Yes, ma'am.
Do you support the idea of using a Medicaid waiver to maybe improve the state's capacity for addiction treatment, and do you hope that's something that might come out of the commission?
So obviously, part of this effort as it pertains to the council will be to explore all waivers, and all of those waivers do not necessarily mean that we will be growing an entitlement. I'm a person who has been very clear that that is not what my desire is. I do think that we can gain greater efficiencies and again, a cost level that people can afford. And when it comes to addiction, the reality is that we know that this is a crisis, and to solve this issue, we have to have far more community resource centers than we do right now. The judge just articulated that, and we as a community have to come together to undergird those individuals that are in this challenging time, just like this sweet young lady right here. We need to be there to help mentor and love on her and give her the resources and encouragement that she needs as well. This is a very challenging set of circumstances that she's having to deal with, and we don't want to lose any more lives. And so all of this is part of a broader context of solutions, and it's not just simply that government needs to be the one to shoulder all the burden or the cost associated with it. It is a shared burden that all of us have a vested interest in. Yes, ma'am. Or yes, sir.
In the proposed legislation that would specifically help grow number of those addiction treatment centers right away, or is that something that's more?
Senator Otterman would like to talk about that.
There's two components in the bill that address this issue, and one is a targeted population waiver. The state already has existing waivers, but what we've heard across the state is anyone, especially young men that are 18 to 40 years old, like Judge Schrader said, there's absolutely no services. I come from a county of 1 million people in Gwinnett County, and when she tries to refer to community-based services, other than the Community Service Board, there are none. But when you go to Cobb County, a great example of a nonprofit that is working is the Davis Direction Foundation. That's the correct word, right? Davis Direction, that is a peer-to-peer support. So encompassed in the new bill in 352, there's two things that the council can examine is those targeted population waivers. And I think that's a very good thing. And what Judge Schrader talked about, recovery centers, there's the option of putting additional money into the budget. For when I went down to Tifton, Georgia, the Board of Commissioners was willing to give a nonprofit a building, but they didn't have the maintenance and operation. So what we're looking at is needs-based community block grants that can be given to places that they have a need, they're willing to work and solve their problems, and the state can step in and help just a little bit, because obviously we have 10 million people, but we can get them started, but then they're on their own, just like the Davis Direction in the zone and the Bread House, and that's specifically why I brought them here, that the state can help, but the local communities has to do their own too. So those are two things that are specifically in this bill.
So that's something the bill is proposing to go ahead and do, or that's something you're tasking the council with studying?
That's what the executive director will examine these and set these up and do. Yes, sir.
Is there any money that would flow to treatment that would be underway this year, 2018?
Well, we already have the Department of Behavioral Health, and we are looking at, and we're in the process of going through the budget, and yes, we are looking at new money. Yes, ma'am.
It could be in the budget this year?
Yes, it could be. Could. That depends on how hard the Health and Human Services. But I think when you're looking at the epidemic, you see the need, and it's just like the governor's saying, if the need is there, we prioritize our needs in the budget process. And obviously, if you're in the middle of an epidemic, that prioritization is going to float to the top.
Great. All right, any other questions?
Can I
Yes.
ask, everything y'all are saying sounds very well thought out, very passionate understanding of the problem, looking at solutions. I talk to advocates who say, y'all have had a year to study, why aren't you proposing what, you could have thought up in your study committee over the past year to be enacted this year, and they wonder if it's due to the election year.
Well, I don't think it has anything to do with an election year. I think to your point is that these are very complex issues, and it's going to take buy-in from all stakeholders, and you have to be very methodical and diligent in this effort, and a very thoughtful process by which gives us the outcomes in which we're looking for. And we have articulated what those outcomes look like. We have put a system in place to give us those outcomes, and I think that is the prudent approach to good governing. So this, unlike what you see oftentimes, where you have a shotgun approach where legislation is put forward that hasn't always been very well thought out. And we have obviously a mechanism now that gives us a much broader context to the outcome that we're looking for. Any other questions? Very good. Thank you all for being with us. Thank you.